Hello, my name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. 3 great articles in my Editor's Choices and 3 series of articles in the PCCM Connections section. So, my first Editor's Choice, Spinella and colleagues from the MATIC group provide a post hoc analysis of 191 children who have had blood product ratios and deficits looked at, all in the context of life-threatening bleeding. Our editorial runs with this and provides great context and importance of the work. The second article comes from Yates and colleagues and looks at the Capcorn Network's experience of inhaled nitric oxide, and it's called Contemporary Practice of INO. Of course, this is off-label, and it's worth reading both the article and the editorial that runs with this. And the third article comes from Pohl and colleagues, and this looks at 526 patients who received 3% hypertonic saline via peripheral venous access. There's an editorial that runs with this. I should just point out that this was one of the last articles that Brad Peterson reviewed for PCCM. He commended this article, and again, I think it's worth reading. PCCM Connections. First, a much anticipated concise clinical science review. This is another in our series of PCCM concise clinical science reviews. This is a Polizzi BloodNet article about MIS-C. Already lots of people talking about it in Twitter. It has a great altmetric score and a great graphic that runs with it. Then there's another article in the series of PCCM narratives, and this essay is called Why We Shout. Again, many people have read it, and I would commend that to you. And then the last PCCM Connections is why not focus on CICU research this month. Along with the inhaled nitric oxide, there are 2 articles from the PC4 collaboration. First, modifiable and organizational and personal factors in cardiac arrest prevention. And then second, an article about direct discharge from CICU to home. And then my third or fourth article in this CICU section this month, think about fluid overload in the care of patients perioperatively around the time of cardiac surgery. So all in all, a great read. Hope you enjoy it, and see you next month.